Hmm. Thanks, Munis, for the nice talk. And Dr. Munis Ashraf was our fellow last year. Now he is in Chennai. He was our sports medicine fellow. Dr. Santosh.
Yeah, so we'll have a short second poll now. So as we are dealing with the injuries, Dinesh, you need to let me share my screen. As a early part of our career, as a doctor, sports medicine person, I didn't expect a golfer to have so many injuries, but in reality, they are prone for injuries. So the next poll question over here for everybody. So you, as you know, post-COVID, so many things have changed. So what do you think of this picture, and whether, as you've seen the picture, whether you think the caddy is doing the right thing or not? So you need to vote for it, and I'm giving you 5 more seconds to finish. Five, four, three, two, one. So there are, rules laid by so many of the clubs. Each one varies, and the common thing is to let the golfer pick up his club, or if at all the caddy is handing over, he should handle only at the head, um, and he should maintain a distance of away. And the various clubs have various rules. So you, sir, you want experts to share their views on this?
Yeah, sure. Can I ask Gopi, what do you think of this? Do we follow this in Coimbatore Golf Club? Have any idea? Would you like to pitch in?
We've recommended, we've not made it mandatory.
Other golf clubs in around the country, Munir, are you strictly following their protocols? You'll have to unmute first. Or anybody else?
Yeah. We just started 2 days back, Doc. So
Yeah.
we had to follow the strict rules, but all precautions have been taken by the TNGF Golf Club.
Mm-hmm. Okay. All right. Then shall we go to the next talk? Next talk is back nine. 9 tips to avoid back pain. Not exactly 9, maybe more also. This is going to be done by Dr. Sri Ramalingam, spine surgeon of Auto One. Sri Ram. No, no audio.
Thank you, Dr. Sriram. So, um, this talk would have been informative, I think. So, let's go to the next interesting poll question. Dinesh, can you let me share my. Yeah. Okay, so for basically this for recreational as well as amateur golfers. So when you swing down, how do you actually breathe? It's an interesting question. So let's see what goes on with the polling, what our viewers think and what our golfers know. Let me share the poll question for you. So all of you must be viewing this. I'm giving you 20 seconds to answer this. So how do you breathe while you swing down? Do you breathe in or breathe out or hold your breath? Interesting. So 5, 4, 3, 2, 1. I can still see some voting coming in. That's why I'm holding on. Yeah. Okay. So as you can see, majority of us, have replied breathe out, and some have replied hold your breath. Okay, so let's first uh, see what exactly happens. Majority of us wouldn't actually wonder or think about breathing at all during swing down. But this comes into play only in those anxious moments in tournaments. It's more with amateurs and pros who are in the tournaments, and when it comes to the tense situation, then you become aware of your breathing, and if the breathing is not proper, it will definitely affect your outcome. But I would like to take a few other sports into consideration. Other hitting sports like tennis, it's definitely breathing out. And there is definite evidence that how if you control your breathing, you could actually increase your strength of your shots. One example is this. You would have seen our players, tennis players like Sharapova, Monica Seles, even Nadal and Djokovic, how much they grunt. There is evidence and science to prove that grunting actually increases the power of the stroke. So that's a controlled breathe out, which is there, and with the transitional holding of breath for a millisecond. So there is evidence to say breathing out with holding of breath is beneficial. And we'll take the other extreme sport where aiming and accuracy is more important, like shooting. They train to hold their breath and they actually press the trigger when they exhale and stop the breathing, hold it and press the trigger and then let go. And even the pros actually try to control their heartbeat also. So golf is somewhere in between I would say this and tennis. And breathing out is important, and probably holding the breath a millisecond is important. So I would stop here and would like to ask our expert panelists what do they think, and shall I ask Madam Mrs. Indrani what she thinks of this? You can unmute your mic and go on, Madam, and other experts on their opinion. Breathing while you swing down.
Yeah, I think this is very personal, like how they're used to, they do. But most often, I think in golf, you breathe out as you're coming down into the shot. So it's completely personal. I don't think some of the club level golfers we are teaching are even focusing on that.
Okay.
Right.
Otherwise, in coaching aspects, this breathing doesn't. It's not evidence-wise. It's not up to the golf evidence. Isn't there, ma'am? Until now.
No, not like that. It's just that it's not the important factor that we focus on when we do. It's a natural thing that happens.
Okay.
Yeah.
So any of the other experts want to take this, sir? Because there are drills for breathing practices in golf training where you try to regulate your breathing and breathe through, and holding of breath while you swing down is harmful, and there might be muscle strain in your trunk. So the holding of breath must be really very exactly at the point where you strike. If you hold your breath a little early, it's going to harm you. So I don't like to waste any more time. So you want to take further?
So we'll get on to the next topic, long drive, science behind golf swing by Dr. Preetham Nagaraj. He is our sports medicine fellow in Coonoor. Preetham.
And from the front view, we can see that he is maintaining his weight on the right lower limb to shift from back swing to forward swing. And then there is sequential rotation of the hip, torso, arms, and the club, bringing it in perfect alignment for the momentum transfer. So Phil Cheetham in 2008 explained the kinetic sequence in the golf. The most efficient sequence of motion is rotation of pelvis, and then the rotation of thorax, then rotation of arms, and finally the club. This efficient transfer of energy from lower limbs to upper limb is called the bottoms-up phenomenon. At the time, can be lost. If one segment has to compensate the other, then the injury may result. So this is a video of the great golfer Bryson DeChambeau, whose long drive was around 423 yards in Memorial Tournament in 2020. So compare his statistics from 2017 and 2020. We can see that there has been transformation in not only in his physique, but also in his technique. So his average distance has improved from 299 to 321 yards, and his maximum ball speed has improved from 174 to 203 kilometers per hour. The secret behind this transformation is solid biomechanical foundation. So the biomechanics of the golf swing can be explained in 5 phases. Here we describe the swing in a right-handed golfer driving the ball towards his left. So the first phase is the ball address. This is followed by backswing, and then there is downswing and impact, and finally the follow-through phase. So in the ball address, the player adopts an optimal pre-stroke posture. He aligns his feet in a line parallel to the desired direction of trajectory. Balance and stability are crucial components of this phase. So he places his feet shoulder width apart, the knees are flexed around 30 degrees, and he bends his torso, hinging at the hip. The ball is placed in a line which passes through the left hip and the left shoulder. So the next phase is called the backswing, where there is activation of the stretch shorten cycle. In this phase, the player shifts his weight to right lower limb, keeping the back and torso perpendicular to the frontal plane. He rotates his hip and shoulders around the spinal axis, raising the club high with the lead elbow being straight. The muscles which are active in this phase belong to the posterior kinetic chain, and they are the external rotators of the shoulder, the latissimus dorsi of the back, and the external rotation of the left hip. The range of the backswing is adapted to individual's height, flexibility, and body morphology. So there was a study published in British Journal of Sports Medicine, and they studied the prominent muscles in different phases of the golf swing. In the backswing, in the right upper body, upper trapezius is the most prominent muscle, and on the left side, it is the subscapularis of the shoulder which helps in internal rotation. In the right lower limb, it is semimembranosus which stabilizes the knee, and in the left side, it is the erector spinae and abdominal obliques which stabilize the back and the torso. In backswing, we generate a difference in the turn angle between the shoulders and hip called the X factor. So this is explained in the sequence of images here. So when we visualize the player from the top, at ball address, we can see that the plane of the shoulder and the hips are parallel to each other. At the top of the backswing, the shoulder rotates to around 110 degrees and hip rotates to around 45 degrees. So this difference of 75 degrees is called the X factor. And further, as it proceeds into the downswing, the hip rotates earlier, achieving a neutral and creating a lag of the shoulder. So this is called as X factor stretch or the dynamic stretch. Both the factors help in increasing the impulse at the ball contact. The next phase is the downswing, where there is phase of acceleration of the club head to achieve maximal club speed. This is the shortened phase of the stretch shorten cycle, and the muscles involved in this phase are the anterior kinetic chain. They are the adductors and internal rotators of the right shoulder, obliques of the abdomen, and the internal rotators of the left hip. So the important muscles of this phase are, in the right upper body, it is the pectoralis major, and on the left side, it is the rhomboids, which stabilize the scapula. In the lower limb, it is the upper and the lower gluteus maximus, which shows 100% activation. And in the left lower body, it's the vastus lateralis, which helps in knee extension and transmission of the force upwards. So the final phase of force generation and transmission is the acceleration phase. This occurs usually at around 30 degrees below the horizontal. And this is where the second pendulum comes into action. The wrist cocking is a strong factor in determining the final club head velocity. And also, as we see in the graphics, it is evident that the ground reaction force is being transmitted from legs to hip, from there to abdomen and chest, and finally the shoulder, elbow, and the wrist. So at ball impact, the forces are transmitted in 0.0005 seconds, which leads to massive acceleration. So the ability to convert the club head speed into ball speed is called the smash factor, and they follow principles of impulse direction. So the part of the golf club that comes in contact with the golf ball is crucial, and this spot is called the sweet spot or the center of percussion of the golf club. So impulse at this point maximizes both accuracy and the displacement. So the lowest point of the golf swing has to be placed few inches behind the ball so as to get the upward or the positive attack angle. The final phase of the golf swing is a follow through. This is a natural continuation of the swing. There is progressive deceleration of club rotation and the body with superimposed and parallel rotatory motion of the shoulders and the hip. In the early follow through phase, the back remains straight and the hip and shoulder rotate around the axis. The lead and the trail forearm go into supination and pronations respectively for a smooth transition of the club head. In the final follow through, the back is erect, the right foot comes off the ground, and the full weight is borne on the left lower limb, forming a reverse C with the club head. In the final follow through, the ball is released and the club head is released. which is a classical of modern swing. So the effective athletic kinetic change should have optimized anatomy in all segments, optimized physiology in terms of muscle flexibility and strength, optimized mechanics in terms of sequential generation and timing of forces. Any break in the kinetic chain leads to increased distal biomechanical demands that decreases the ultimate velocity or force and compensation by distal muscles leading to the injuries. So few words on classic and modern swing. In the classical swing, there is large amount of hip rotation with the torso rotation. That means that the difference between the shoulder and the hip rotations is decreased, thereby lower X factor. So here in diagram, we can see the belt buckle faces towards the right. That shows increased hip rotation, thereby reducing the difference in the rotations between the shoulder and the hip. Whereas in modern swing, we see that there is restricted hip rotation with maximum amount of torso rotation. So greater X factor is generated in modern swing. And also in follow through, the player has a less upright posture in classical swing. The momentum is carried more laterally than vertically. However, in modern swing, we can see that the player remains more upright with an extended lumbar spine. So which swing is right for me? Every golf swing is unique, and there should always be a balance between maximizing performance and minimizing the risk of injury. Local teaching professionals and simulators help assessing the efficacy of your swing. How to increase the driving range? Improve trunk rotation and flexibility, avoid excessive movements and practice safe swing techniques. Seek professional guidance and make technical modifications as guided. So a systematic review of golf warm-ups was published in 2019, which showed that many recreational golfers do not warm up before golf play. And of those who do, it is short in duration and involve air swings. Educational sessions or seminars will improve the warm-up behaviors of the recreational golfers. Warm-up should include dynamic stretching and light resistance exercises to enhance performance. Static stretching should be avoided and should be limited to post-game sessions. There have been studies which say that to enhance the golf performance, we should focus on flexibility exercises like dynamic knee to chest or the walking knee to chest exercises, torso twists, strength exercises like front squats and deadlifts, and power exercises like the Olympic lifts and the snatch. The power exercises are the compound movements which are done in short duration. They not only encourage explosiveness, they also enhance the control and coordination of complex movements. There are certain golf specific drills which help in getting the golf swing right. There is takeaway drill which helps in keeping the lead elbow straight throughout the swing. Top of the swing drill which helps in maintaining collinearity of the shoulder and hip rotation. The left arm rotation drill which helps in the sequential motion of the forearms and a smooth transition of the club head in follow through. And hand rotation drill which helps in rotatory flexibility of the torso. To summarize, by improving balance, we optimize dynamic stability, reduce deviation from ideal swing plane, and ensure more consistent swing. Optimal performance requires precise mechanics, coordinated kinetic and kinematic chains to develop, transfer, and regulate the forces. Impaired performance or injury are associated with alterations in these kinetic chains. So I would like to conclude my talk by quoting famous Ben Hogan, who says that the most important shot in the golf is the next one. So I wish all the golfers fairways and greens in their future games, and thank you for your patient listening.
Thanks, Preetham. I'm sure there are going to be a lot of questions on your talk. Now it is time for Dr. Santosh for the poll question.
Yeah. So I think a lot of information on swing biomechanics was shared by Preetham. So, simple poll question. Pick the key muscle for a powerful long drive. So what do you think is the key muscle? I know every muscle is important here, but it might be a trick question. All of the above must be the right answer, but no such choice is there. So I just think usually all the muscles are built up with their regular swing. But for you to get a powerful long drive, which is the key muscle? So if you want to pick some muscle, which is the key muscle, which is the one would you pick? That's the question here. So let's go to the poll, giving you 15 seconds to vote. So is it the thigh muscle? Is it the gluteus, called the butt muscle? Or is it the trunk, which is the back and maybe the abdomen? Or the arms, forearms? So there's a lot of voting coming up. So I'm going to stop the voting in 5 seconds. 5, 4, 3, 2, and 1. Let's see what's the result. So majority have voted for trunk muscle. Yeah, trunk very important. But as far as the evidence is concerned, majority of the players with their regular activities and swing, they tend to strengthen their shoulders and trunk muscles. But what they lack is the gluteus, the butt muscle. So for you to get that long drive, strong and powerful, the twisting of the hips are more important. So even though trunk might be a right answer, to get a powerful long drive, your glutes are more important. So you can take over. Unmute, sir.
Yep. Okay. So we'll get on to the next talk, the fourth talk, Psychology of Golf by Dr. Piyush. Piyush is an anesthetist turned pain management doctor, so that he'll have more time to play golf. He's also an author. He has authored 2 books. He's going to be authoring one more book very shortly. Over to Piyush.
I'll be talking on psychology of golf, basically the sports psychology and how it is very important and more significant in golf of all the games. Brief history about the game, as most of you all know, it was played by shepherds on the links who were grazing their sheep, and they had nothing to do. So they used to knock a pebble into a hole with sticks in the non-arable land, which used to support grass, but you could not use it for agriculture. So this first fact itself shows that golfers had a different mindset. Only a person with a different mindset will, in an icy condition, chuck small pebbles into holes with sticks. And this sports psychology really took off in the Cold War years because of the intense rivalry between US and the erstwhile USSR. All methods were used to increase the output of the sportsman. So psychology of sport was pushed to the limit. Winners were rewarded lavishly and losers in some countries were punished severely. So pertaining to golf as such, it is how psychological factors influence sport. If you have the correct sight and you have control of your mind, then it can influence your sport. In fact, in golf, the mind plays such a role that there are a lot of people who say that it's the part between the 2 ears that is very significant in the game. So it improves well-being and brings about continuing improvement of the sport. Attentional focus and visualization. You come back and you visualize the shot and then you hit the shot. Though more often than not, it will not end up as you had visualized. But that is one way of getting the psychology, the mind into it. Then there is a part of motivation, which can be both extrinsic and intrinsic. Extrinsic can be getting a golf scholarship or a good sponsorship. And intrinsic is what most amateur golfers, club golfers feel, that is, you feel good in yourself. Anxiety and nervousness and the ability to control these 2 factors is the most important part of golf psychology. Rehabilitation after injury takes a lot of psychology and psychological support. Anger, frustration, hopelessness, fear. As an example, the present Italian left back who was waiting for a huge contract tore his Achilles tendon a week ago and he's out for the next year. So you really don't know what is going to happen to him. There is anger, frustration, family, where his earnings are coming from and things like that. And the last one is preventing burnout, that everyone knows. Now you compare 2 games. golf and football. The golf, the main thing that usually puts people's mind at an unease is that the ball is stationary. Whereas in football, the ball is moving. It happens at a slightly more unconscious level, meaning it's not really conscious hitting of the ball. It happens like in a dance. Now, there are endless variables which are particular to golf, which makes it more difficult. The distances can vary. The clubs can be very ill-suited and more than necessary in a bag sometimes. And it is akin to a fork and knife. You bring a person off the street and ask him to eat a plate of noodles with a fork and knife. It will be difficult in the beginning. Then the terrain, elevation, soil conditions, these are all things that play on the mind. And especially on our course, the wind really blows through the Palakkad Pass. And the ball is stationary. I'll keep repeating this point because it is very important. Now, if you have played the game from childhood, and even if you have played other games before, like say cricket, etc., then it comes a little bit more easy. The hand-eye coordination is better. There are a lot of cricketers who are very good golfers now. And the idea is to come to a stage where you play without thinking. And there are spectators on the course, which make it more difficult. And spectators are waiting for the next shot. If you again compare it with football, it is like a series of penalty shootouts. We are seeing a lot of top players missing the goal from 12 yards out. It is only because of the things happening in the mind. So there's lots of time to think, and there can be a lot of peer pressure. The CEO of a company will be thinking, will I make a fool of myself in front of the working class? These are some more features of golf which are unique to the game. Every shot counts. The previous bad shot might spoil the subsequent shot. There are no teammates to help you out. And it is seen that amongst equally skilled players, 90% of the time, the mentally stronger player usually wins. Among frequent winners, it is seen that 24 out of 32 factors that they factored were common. So there is something common amongst good players. Repeated mistakes like finding water, going into the bunker, unfamiliar distance always preys on your mind. This is how this photo shows what pressure can be. The fellow in the middle is putting, and it's a typical links course. On the top left, you can see the sea. On the extreme right is where the arable land starts. This is pressure, total silence, but definitely, usually, someone will laugh when you're about to putt. Now, I've proved to you all that there are a lot of fertile ground for a psychologist to play a role. Only 1 in 5 rounds are around the handicap. So trying to play well all the time is additional pressure on your hand. Youngsters have to be treated with kid gloves, and I've seen a lot of things in courses that the psychologist can really help the parents too. Good aspiring professionals are the ones who gain a lot from a psychologist. Club level golfers usually deal with it themselves or ask a player who's slightly better than in your field. Biomechanics, kinesiology, and exercise physiology, my previous speakers have covered it. Exercise physiology, breathing, as Santosh mentioned, does play a role. You can take a couple of deep breaths before your shot, or you can use your breathing as a cue for the stroke to start. Relaxation, yoga, brain food, wellness, these are all the things that can be used. Now, there are a few words which are very in vogue. One is body language, we all know what it is, or you choke on a shot. At the crucial time, you play a bad shot. And these two terms, flow state and in the zone, are important. And I'll just elaborate a little bit on it. Mihaly Csikszentmihalyi in 75 saw that artists, writers who get lost in their work for a long time. They might work for 2 days without thinking of time, food, even sleep. So they are fully immersed, full involvement, and intense concentration. So they had a feeling if you can get this state into your mind, your sports psychology, then maybe you'll perform the best. But one's mind can take in only a certain amount of information. After that, apathy, boredom, and anxiety slips in. So if the skills of the person is very good and the demands are not very good, then he'll have boredom and he's not very interested in it. But if the tasks are overtake the skills of the person, then anxiety creeps in. So the idea is to get a balance where everything is done properly. Now, an autotelic personality, this is what
Last talk today, transition to senior golfer. Last talk today, Ganesh.
Autotelic personality is one who only thinks of the experience of the goal. This is a person who may be an autotelic personality that's only bothered about the particular thing at hand, not bothered about food, or you go to the house, there won't be any decorum, or clothes will be all over the place. They're just thinking of the idea of the task at hand. Muscle memory is something which is much talked about in golf. It's a specific motor task which you keep repeating so that it gets into your memory. It's a procedural memory, also referred to as motor learning, performed without much thinking and limits limb stiffness. Bicycle riding, driving with music on, musical instruments are also part of memory, muscle memory. In fact, musical instruments can be tricky. Pianist, you can have a left hand memory and a right hand memory going to different places in the brain. So you consolidate the pathway by repeating your shot so that your shot turns from an awkward one to a smooth shot. And you can have a trigger cue, a pre-shot routine and a trigger cue before you hit the shot. And this is why I think last but one slide, hips is something that suddenly happens in golfers. Sudden unexplained loss of skills. And it is due to mainly because of muscle memory and decision making, there is an aberration. And it's not seen in new players. Players who have been playing more than 25 years are most prone, and there might be biochemical changes which accompany aging. As we are finding out in many diseases now, like Alzheimer's, there is biochemical changes going on in the brain which causes it. So it may be brief duration, it may be a long duration, and the last one, the player may be forced to give up because it's not difficult, it's not going away. So these are the things which it is due to. Focal dystonia means you have little spasms. A classic example is your eyelids sometimes go into twitching. You can have tremors in your hand, physical causes like a ganglion, and eyesight itself. Treatment is, psychologists, you can take a break for some time, change equipment and change biomechanics. This is to create a different pathway and different muscle memory. 33 to 48% are usually affected, all the golfers put together. Other sports also this happens. In baseball, it is called Steve Blair's disease, and it's usually in pitching. It's seen in darts, snooker, and cricket. This is what a golf psychologist doesn't want to see on the greens. So the whole idea of the thing is not to get into this situation. Next one. This is the last slide. Now, P.G. Woodhouse was a big writer of golf stories, and he had a few terms which highlighted the fact that he also knew there was something going on in the mind. First one is golf, like measles, should be caught young, because if it's caught later, then the results may be serious. Real golf is a thing of the spirit, not a mere mechanical excellence of stroke. The least thing might upset you, like butterflies in the meadow, the uproar of the butterflies in the meadow. You can't play a real hot game unless you are so miserable that you don't worry about your shots. And the last one, he enjoys perfect peace that comes only to a man who has given up golf. Thank you.
Thanks, Piyush, for the eloquent talk. No wonder you're a writer and author. I'm sure there are going to be a lot of questions on that. There are a lot of questions coming in from YouTube. Santosh, do you have anything now?
Yeah, as usual, a poll question.
Yeah, the last one is there.
Yeah, that's the one. So, as you're dealing with psychology, golf is an addicting sport, and definitely, yes. But what's the reason for your addiction to golf? So, I'm going to start polling for this. Is it the love of the game, or is it the environment which you play, the course, the scenery, or is it because of the friends, or is it for the party post golf evening sessions? So 5 more seconds. 5, 4, 3, 2, 1. So there is some majority of you are those who love the game. It doesn't matter where you play, whom you meet, you just love the game. That's great. So up to you, sir.
Okay, we'll get on with that last talk, which is my recorded talk. Dinesh, can you start, please? The last talk today, transition to senior golfer. It is time for the senior golfers to understand sports medicine applied to them. There are several journals in sports and sports health dealing with golfers and senior golfers especially. There has been a lot of knowledge for the last 10 to 20 years. In the year 2018, British Journal of Sports Medicine conducted a meeting and came to a consensus regarding seniors especially and golfers in general. There was 79 consensus point and 4 of them for seniors, meant there is definitely a health benefit for the seniors. There are balance benefit and strength benefits for the seniors, and which means that day-to-day life, your trip and fall becomes less if you continue to play golf, and thereby your chance of breaking the bone is much less. There's a lot of social interaction which results in physical well-being also. WHO recommends an aerobic activity level for the seniors 150 minutes per week. This fits in very well with golfing 18 holes or 9 holes twice a week. So in general, is agreed by everyone that golfing is good for the seniors. What are the challenges for senior golfer? Pre-existing heart disease, impaired vision, example cataract. If somebody has got a cataract, it's become a tubular vision. What is in the periphery may not be seen, so we can trip and fall. So therefore, correct the cataract. If you have a pre-existing heart disease, consult the cardiologist and take the medication, and above all, know your limits. Finally, the musculoskeletal issues are the most important. With aging and golf, the strength loss, the nervous system can slow down, bone mineral density can come down, and collagen impairment can lead to pain and ache, and joint cartilage can degenerate, can result in osteoarthritis. First, the aging can result in muscle strength loss and bulk loss, which is called sarcopenia. For example, for a 7 iron, one loses 4 yards for every 10 years beyond age 30. They can be combated, can be nullified by specific and strengthening exercises, which we will see later. The nervous system, nerve conduction velocity can come down, and proprioception or balancing can also be lost by 10% over 10 years, 60 years, and reaction speed also comes down. Golfing maintains a rapid response, and strengthening and postural maneuvers which you have to do when you play golf results in improved balance. Metabolic and hormonal changes can lead to osteopenia or osteoporosis in the aged, but golf, due to gravitational loading, improves bone mineralization provided you don't use the cart and keep walking the course. Aging reduces flexibility, increased brittleness, prone for injury. While playing golf, physical activity can improve collagen turnover rate and prevent incidences like tendon Achilles rupture and others. But one has to stretch and maintain the collagen strength. Aging also can lead to cartilage damage and osteoarthritis, reduced range of movement. Golf, weight-bearing exercises increases cartilage thickness and thereby slows down pain due to osteoarthritis. Mobility also improves synovial fluid diffusion. So, the foursome injury prevention in the elderly are: 1, warm up, primary importance; strengthening, I'll show you a little later; and functional training as per the function which is going to be performed; and correction of swing technique, which we will see in the next few slides. In the first phase of functional training, spinal stabilization and develop neuromuscular control. The second phase, increase muscle strength, and the final phase, enhancing the speed of movement and muscle power. I'll show you by exercises towards the end. The right swinging technique is very important. Correct technique minimizes injuries to the left shoulder. There is a lot of talk about classic and modern swing, which is better for the senior. The classic swing and the modern swing. It is a modern swing which is recommended for the seniors, but there is no real evidence to it. There is no proof to it. Modern swing is what is recommended for the seniors, but it restricts hip rotation. There is more torque and X factor and more axial rotational force on the lumbar spine. There is increased lumbar crunch, which is not good. So is it classical swing, modern swing, or is it hybrid swing? Do everybody know what swing they are following? Or is it open foot stance, or the left foot 30 degrees externally rotated? Is it the correct stance? Will that help to reduce the back pain? Probably the walk through shot may be producing lesser strain on the back, as advocated by Gary Player. So the take-home message is golfing is good for seniors, for mental as well as physical health and neuromuscular coordination, thereby preventing fall and fractures. It definitely improves the senior person's quality of life, provided you use the proper technique for the swing, do strengthening exercises, stretching exercises. Once you do all this, you can prevent any pain and have a long innings of playing golf. Thank you. Well, there's going to be one poll question, after which we'll quickly go through some discussions and then finish the meeting. But because for want of time, we are not showing you the stretch and strengthen routine that will be available in the YouTube for you. Santosh?
Yep, troubling you again for the last poll question. What style is your swing? So Launching cool. Yeah, what style is your golf swing? Is it classic or modern? We have learnt about it, but whether it's a hybrid mix or it's a walkthrough or you really don't care or don't know, you just swing it out. Let's see. So counting down 5, 4, 3, 2, 1. Okay. So majority have chosen, they do the modern swing. Okay, up to you, sir. So that's
Okay.
Yeah.
That's right. Tarun, what's your opinion on that? I mean, what kind of swing do you teach? Would you like to share with us?
So I think there's a bit of a confusion here between the modern swing and the classic swing, because I'm actually not completely in agreement with what has been described as the modern swing and the classic swing. Because today, I think because of a lot of knowledge that's come in and how the spinal movements have been actually understood, because in the backswing, your spine has to actually move into extension, and I think it goes up to 5 degrees from 0 of extension, the top of the backswing, right? So to facilitate that, you can't keep the right knee flexed. The right knee has to extend, and because the right knee has to extend, we don't have these X-factor swings actually happening much more, because a lot of research has shown that the X-factor swings are actually the ones that are causing injury. So if you pull up the picture of Dustin Johnson, I don't know, somebody had put up a video of Dustin Johnson, you'll see how much his trail knee, that is his right knee, extends to the top of the backswing. And because his knee is extending, it's actually giving his hips more freedom to turn, right? So he's definitely hitting it very long, but he doesn't have the X factor at all going in there in terms of, he's not working on that. So the modern swing, according to me, is one actually where there's less X factor stretch happening in the swing, and there's more freedom, because if you look at golfers like Michelle Wie, you look at golfers like Jason Day, they worked on the X factor stretch method, and both of them have been really riddled with back injuries. And that's one of the main reasons that you're seeing a lot of back injuries. So I think the modern golf swing is a little confused between the classical golf swing. And the other thing with the classical golf swing, of course, if you look at the knee movement now, it's also been understood, because in the classical golf swing, you see a lot of valgus with the lead knee, which actually leads to more issues with the lead knee than just an extension and flexion of the of the knee. So if you look at the players today, their lead knee actually moves forward; it does not move inward. Okay, so it's kind of a straightening of the trail knee and a bending of the lead knee, which actually gives them that freedom. You talk about the foot position also. Today, a lot of golfers you will see on the professional circuit have both feet turned outwards, not just one foot. And the reason for that is you want to reduce the amount, or you want to increase the amount your hips can actually turn in the backswing, right? And because of that, we are also seeing less injuries. So for an older person also, you would encourage that. But even my junior golfers today, I encourage them to open both feet, because I don't want them restricting any movement in the lower body. No doubt the hips will turn less than the shoulders in the end. That's true. But if you look at even some sources like the TPI, for example, the TPI has a system of testing your body, right, to see what the range of motions are and what they can be. But all those tests that you see the TPI do, they're designed to make you fail. To give you a simple example, if you look at the thoracic rotation test, which the TPI does, it makes you keep your knees together, sitting down in a chair and bent, and it tests your thoracic mobility. Now, nobody in the world can achieve, I think, 40, 45, 50 degrees of mobility from that position. Because in the golf swing, your knees are straightening, right? And because your knees are straightening, your thoracic mobility will be more automatically. So I think the modern science has helped us understand a lot of these things. And we're actually moving away from the older, and I would say the X factors and older, probably in the mid 80s, early 90s, mid 90s, I would say, was, but then I think a lot of scientists, a lot of biomechanists really kind of realized, how the body was moving, how the spine was moving, right? Now, if we talk about the lordosis in the spine also, we do see lordosis, the setup, but you have to also look for the same lordosis at the top of the backswing. It has to be kind of recreated and at the finish, right? So what people normally call a reverse C, is actually pretty good for you because your spine is going back into extension at the end of the swing, which is again recreating that normal spinal lordosis, where most players today are leaning forward at the finish of the swing, right? And they're actually going into spinal extension, which then also puts a lot of pressure on the lower back, rather than going back into the regular lordosis of the of the spine. So, I think there's a bit of a I think as doctors, if you can go a little deeper into that, as a sports medicine doctor, a little deeper into that study, probably will also bring out some very, very interesting facts. And you talk about weight transfer as well. Today they found that the weight actually doesn't shift to the right foot; it's primarily pressure shifting. So we're actually mixing up center of pressure and center of mass. So the pressure shifts to the right foot, but some of the best players, if you look at Dustin Johnson again, right? If I'm extending my trail knee, how am I going to keep weight on that side? I'm actually moving more weight to the lead side at the top of the backswing, which is what most players are doing today, which is also what's making them good ball strikers, because they don't have to worry about shifting back and shifting forward. They're actually turning around a very, very stable hub. So weight shift also is misunderstood. So from a coach's standpoint, I think this was a great seminar. Lots to learn, but I think, if you all look at where science has taken the modern the views of the golf swing, it's a little different nowadays. There's a lot of study that's gone into it, and a lot of injury prevention is happening because I think as coaches, also a lot of coaches now are actually delving deeper into understanding how the body, how the body also moves, weight shift, spinal movements. For example, if I have to take a full backswing, right, and I want to keep it with my lead knee flexed, that's a number one recipe for a back injury. So today coaches are teaching more of allowing that lead knee to straighten, so your hips get more freedom, so your thorax gets more freedom. Now, if you take an older golfer and he has a problem turning, right, or there's probably some a test done on him for thoracic mobility, right? All you need to do is sometimes ask that older golfer to straighten his trail knee. And when he learns to straighten the trail knee, suddenly the thoracic mobility increases, right? So there's so many things that you can actually look at in terms of understanding technically how the golf swing, how the golf swing might work better, if you look at it a little differently. So I would say the modern golf swing is actually moving away from the X factor and moving more into, I would say focusing on the spine being a little extended at the end of the swing, which brings back the lordosis at the end. And all of these, and even the extension of the spine today, or extending the spine through impact, has shown to increase club head speed. It's like you throw a cricket ball, right? At the last movement, you're extending your spine, right? That's what actually creates that braking effect, which helps you to release with the hands. The same thing in the golf swing as well, right? But a lot of golfers today are told to transfer their weight to the left side. So they misunderstand that, and they actually move into flexion at the end of the swing, which again puts more pressure on their lower back. So, I think just a little more, I would say, understanding of, I guess, the difference between the modern and the classic. Today, if you look at any golfer, Dustin Johnson is an extreme case, of course, but look at any golfers, and what's their right knee and what's their trail knee, right? And you'll see that it's become pretty common now. We have all the golfers, who are actually, extending and straightening their trail knee, taking the pressure off their back pretty much completely. So yeah, I think if I were to look at, I don't know what I would call the swing I teach, but I would just call it a more body-friendly swing, right? So because today our younger kids are hitting the ball really hard, and it's good to hit the ball hard. But I think, if you understand how the body works and what can and cannot cause injuries, we're helping our players obviously much better. So that's where I am on this. I feel that what I teach, I feel is modern, but not modern in the sense that was put across today. It's a little different now, and I'm sure I'm happy to work with any of you on actually a deeper understanding of the so-called the modern way of swinging the club. If there are any questions, I'm happy to
Indrajit, I think I would like your input on the swing. Would you like to tell us something about it, please? What is your take on it?
I think Tarun has already talked enough about the golf swing. I just wanted to make one point because we are speaking about injuries and how golfers have hurt themselves, and Tiger Woods with his multiple operations. But if you go back in up to the early 90s or maybe end of the 80s, you had the Nicklauses, you had the Tom Watsons, you had the Bernard Langer who's still playing. They played golf injury free when we were kids, and till the 90s, you never heard professional golfers hurt themselves. And that is today golf trying as athletes, they're trying to push themselves to get that very little bit. Today, the golf equipment has advanced so much. And when we were in our early days playing professional golf, we were playing with wooden clubs, and the difference in distance today is hardly anything. And the kids and the youngsters and most of the golfers are pushing themselves physically to a point where they get injured. I mean, you'll never hear someone like a Jack Nicklaus missing a year with an injury or with an operation. Or today, if you take Watson, I think a few years back at 59, he almost won the British Open, and he beat all the Dustin Johnsons who were 200 pounds of weight, and Tom Watson probably never picked up more than a 10 kg dumbbell. And he was competing with people who were young enough to be his grandson. And I'm talking about less than a decade back. So I think injury is become a lot more serious because golfers are trying to make themselves look more like athletes, or they want a nicer body. Today you'll hear of Rory getting hurt. Today you hear of Tiger Woods getting hurt. But in the 80s and 90s, you never heard golfers getting injured. So I think there has to be a line drawn, and an athlete, a golfer is an athlete, but I think they need to train like golfers, where you can take out a lot of the stuff that you do, which is putting pressure on your body, and not push yourself to do things so crazy. That is my only. I don't want to really go into the X factor and everything because Tarun's already spoken about it. And I think we're coming closer to an end of this discussion, but I'm ready to take any questions anyone has. Thank you.
Right, thank you very much. And we'll get on to something else about psychology of golf. I would like to ask, I think Indrajit. Indrajit is that psychologist, a sports psychologist. How to deal with the pressure of getting a bad shot is from one of the attendees. Can I ask you the question, please?
See, golf. Yeah, so before I get how to deal with a bad shot, I think one needs to understand that one of the toughest things, that one of the reasons why golf is so much tougher than playing cricket or football or tennis is because golf is not a reaction sport, and you have only yourself to blame. So when you hit a bad shot, you can't say that he bowled a Yorker to me, or he served a swinging serve at 130 miles an hour, or he dribbled past me and he was much better than me. Here you are your only opponent. So when you have a situation like that and you have only yourself to blame, the pressure is a lot higher. Second thing is you're hitting a stationary ball. So all the momentum, all the power, everything has to be created. So these are the things that make golf really, really tough. And the errors are obviously increased because of the factors that you're the only factor out there. So the way to deal with it is to basically have a routine, have someone mentioned, you have a pre-shot routine or you have cues. So if you have a pre-shot routine, playing the game becomes a lot easier, and dealing with pressure and handling a bad shot. Well, it's very easy for me to say that you hit a bad shot and you got to take a couple of deep breaths and move on with it and live in the present, but it's virtually impossible. A bad shot will affect you. And every human being does get affected by a bad shot. If it doesn't affect you, means you don't care. And then obviously you'll not be playing with that much of focus. So the only way you can deal with bad shots is to basically play every shot on its merit. Golf is the entire pre-shot routine process takes only about 8 to 12 seconds. So if you have to hit 70 shots and you have to concentrate only for 10 seconds, then you are only concentrating for 12 to 13 minutes in a round of golf. And that also not at a stretch, but only at a 10-second stretch. So what golfers need to basically focus on is to be able to control those 10 seconds every few minutes, which matter. And if you can do that, then I think handling pressure becomes a lot easier.
Very valuable, Indrajit. And do you practice positive imagery? Gopi, can you answer the question? Do you practice positive imagery while playing? There's a question.
I'm usually very positive when I'm on the golf course, Doc. I've been playing it long enough. You know, there's a quote that it is the greatest game. I think it's the greatest because possibly it's also the least understood. The amount of time you have to think over it is much more than the time you actually play. So, positive image, speaking from a club golfer's standpoint, I think possibly is limited because the typical club golfer tends to see the obstacles and the hazards. So if you only see the obstacles and hazards, it's a little hard to stay positive. At the top amateur and pro level, yes, the mind is conditioned to focus on what you want to do rather than what you don't want to do.
Thank you. Munir, what's the secret of your playing so many games and excelling in all games, including golf? How is golf different from hockey or squash?
Doc, to tell you honestly, when I've been playing, like you mentioned earlier, all the games possible. All the games that have been fast games, like squash and hockey and polo and whatnot. And I used to see this game, golf, and I thought, what a stupid game this is. People standing, walking. Then after my, almost near my retirement in State Bank, I said, let's, with some other friends of mine from the MCC club, let's join. So I all joined, and then after that I found this game was something, it was, I won't like to miss. And the fact that I'm still lasting is like having listened to all the specialists about the physical fitness. This is what has helped me. My main reason for, or rather my body lasting is I do a lot of warm-up, I do a lot of stretching, I do a lot of exercises, and it's on an everyday basis, not just once in a way. And I do a lot of walking, and I can't just keep quiet. At least every day, at least 1 hour I must spend on the ground or on the squash court or playing hockey. But of course, hockey is not there, no, club hockey. But the fact that my body, I have had injuries. I had a left shoulder injury, 20% ligament tear. I came back, you only helped me. Then I had a back injury. Of course, the back injury keeps coming and going, but then a lot of exercises, a lot of warm-up, and a lot of hard work to enjoy my golf, enjoy my sports. I am doing everything what I heard from you people. I've been doing, putting this in practice, and that is what has helped me in continuing with this game and continuing with all the games.
Right, thank you very much. Yeshua, can I ask you, is wearing the corset, is it against the rules or is it okay with the rules and regulations? Because he's an expert on international rules.
Well, so long as it doesn't specifically aid in your play, for medical reasons, yes, you can wear. But if there is reason to believe that that's being worn deliberately to get advantage of the situation, then we would not view it very well. We would perhaps penalize. But for medical reasons, yeah, for sure.
But there are no restrictions at all. I mean, do you check the Do you have to check the corset if somebody is wearing in the
So
competition?
there are restrictions, and that's a bit too deep to go in at this time. But suffice to say that medical reasons are fairly well documented, and the administrators are also reasonably well positioned to understand them. And they do take a view to help the player if possible. But as I said, if that is going to disadvantage the rest of the field, then that would not be a device, an artificial device would not be permitted.
Thank you. Indrani, can I ask the question that how opening both feet help in trunk rotation? Is a question from the YouTube. How opening both feet helps in trunk rotation?
It allows a more freer movement of the hips in the backswing and in follow through.
Do you lose the aim by that?
Pardon?
Do you lose the aim if does the ball go elsewhere than your swing? Does it falter by opening the feet?
It depends on how much you are talking about. Inside 30 degrees, it's fine. And the ball going in different direction also depends on the setup and posture, whether he's able to maintain it through the swing.
Right. Okay. Any questions from the panelists you want to ask the other person?
Yeah, actually, I'd like to just make a comment, Dr. Rajan. From an administrator's point of view, there's a lot of learning that are perhaps not communicated to the golfing public at large. These are, perhaps closely held. I'm not for reasons otherwise, but they are known to coaches and maybe some elite amateurs, and maybe not so many professionals as well. So I'm actually looking at putting something out into the public domain in a simpler form. Too much jargon, too much medical terminology will perhaps serve to distance the amateur from these learnings. So I think an opportunity exists now that for us to work together with you as the medical specialists, with our specialist coaches like Inder and Tarun and the NGAI, which is part of the Indian Golf Union, to put something out into the public domain which can be easily understood and appreciated and perhaps easily can be followed.
Thank you. That's a good suggestion. And it's already 9:30. I think it's going to be 9:15, and we have overshot by 15 minutes. And we doctors enjoyed the discussion. Thank you very much for joining us, in spite of the fact that you didn't know what we were going to talk about and what the standard was going to be. There have been some teething trouble at the beginning because the net was not working. Please excuse us. But however, we like to conclude this meeting by thanking Ishwar, Indrajit, Tarun, Munir, Gopi, and Indrani. Thank you very much for your participation. Thank you.
Thank you very much.
Thank you.
Thank you.
Thank you. So.
Recording stopped.